Most of us will suffer from back pain at some point in our lives, but what do you do when that back pain doesn't go away? Well, Dr. Jay Bhatla is an interventional pain management specialist with minimally invasive spine care, and he also brought with him today a patient, and that's Barbara Goyen. Guys, how are you today?
Hi, doing well.
Good, and I know you're doing well now, Barbara, and we're going to get to your story in a second, but let's talk about chronic back pain, doctor, and why it's so hard to treat.
Absolutely. Well, first of all, thank you for having me back on the show. It's always a pleasure to be here.
Good.
But getting back to chronic back pain, it's very difficult to treat at times, and that's really because our spine is a complex network of bones, nerves, and discs. And oftentimes, any of these things can be prone to injury and stress as we age over time. In addition to this, we have muscles that overlie this area, and these can be subject to strain and spasm. So as you can imagine, an accurate diagnosis is very important in order for us to effectively tailor treatment for our patients.
Okay.
Now, the good news is that at Minimally Invasive Spine Care, we have board-certified, fellowship-trained physicians that specialize in focusing on accurate diagnosis with effective therapies.
Okay, that is good news.
Yeah.
Okay, so when do we know we need to seek treatment? Sometimes people think this back stress and pain is just a way of life and getting older. When do we know this chronic back pain needs some attention?
Well, sure. I mean, anytime you're really suffering from chronic back pain and it's just becoming too much, the first step really is just giving us a call and setting up an initial consultation. At that point, we'll set you up with one of our spine specialists, and we can really talk about what's going on with your back. Okay. The first step is we're going to take, obviously a thorough history and physical with you to really determine the nature and severity of your pain. And then at any point, if you've had x-rays, MRIs, nerve conduction studies, anything like that already done, we'll certainly review those in depth with you.
Okay.
And really, we take all this information together, and we're able to tailor an effective treatment plan for you.
And there's good news even in that, because not just therapy and injections can be used for minimally invasive procedures for treatment, but there's also the NIP procedure, which you've brought on before. Talk about that.
Yeah, so I'm glad you brought that up. That's one of our newest treatments. It's kind of our most up-to-date therapies, but as you can see, this is a very, very small device that we can place to help treat chronic back pain. This is the device itself. It only weighs about 7 grams. It's percutaneously placed, which means it's just applied on the skin. It doesn't require any sort of anesthesia for placement. It doesn't require any radiation exposure, and it's really been shown to help decrease chronic pain. The way it works is it sends a few small, non-painful electrical pulses to different nerve endings that are located in your ear, and this really helps reprogram the pain signals that are being sent to your brain to help reduce your chronic pain.
And I know, Barbara, you understand this firsthand, because I want to share with the GMT viewers your unique and personal experience with the NIP procedure. What was your story?
Well, as the doctor mentioned, this is to treat pain in the back. And I was having terrible, terrible back pain in both my upper and my lower back. And I had gone to the minimally invasive spine care, and they had helped me tremendously by placing this device behind my ear. It was done in about 15 minutes, which was great. The unique experience that I had with it is that I was diagnosed about 3 years ago with macular degeneration. And for the people that don't know what that is actually an eye disease where you get black spots on your macula, and so you can't see faces, and eventually, you can only see out of your peripheral vision. And I had mentioned to the doctor the second time that I went in for my NIP procedure that I was able to see out of one of the eyes that I was not able to see out of before.
Wow.
And I was walking around like a crazy person, with one eye shut, because I couldn't believe that I could see out of it. And I had been reading off of a 46-inch TV monitor my emails, because I was on so many drugs that I didn't know if it was the drugs that was causing the eye problem, to be worse, or if it was my macular degeneration that had gotten worse. And because of using this, I really believe that it's been able to help my vision.
That's really great. And Dr. Bhatla, I'm sure this pleases you so much, because obviously the benefits are grand, and I wish we had more time to talk, but I think this testimonial is really great, Barbara, and thank you for being here to share this with GMT viewers today. Dr. Bhatla, always good to see you as well. Okay, this is where you can get more information. Log on to SpineCareDFW.com or call this number 972-255-5588. Carrie,